Vaginismus is a condition which is not well known. Whenever I talk to people, medical or non-medical, sometimes even the medical people are surprised to hear there's such a thing. What it actually means is that a woman, when she attempts any type of penetration, vaginal penetration, her vaginal muscles go into spasm, and in effect her vagina closes itself and penetration is impossible, and any attempts at penetration are extremely sore. It's much more common than people imagine, because it's a condition that's not talked about very much, not even among women. Women generally speak much more openly about sex with one another than men do, but when it comes to this condition, generally sufferers do not mention it to anybody apart from, obviously, their spouses tend to know about it. And most women who suffer from the condition would have had no idea prior to attempting intercourse, for example, that they might have a problem, because generally their interest in sex is very strong. They enjoy sex, they enjoy all sorts of sexual intimacy otherwise. So when the time comes to attempt intercourse for the first time, they're often extremely surprised that this has happened, and it's beyond their comprehension why it has happened. But it is very dramatic, and it causes a lot of problems, or it causes a lot of upset for people, because it obviously affects the woman, and she feels she's not a complete woman often, and it affects her partner because it can be very frustrating for him. The interesting thing about it is that generally women and their partners suffer with it for many years before they look for help. And in my experience, the women and their partners generally come for help first when they want to have children. So they may have been married for many years and have found a way to enjoy sex together without having sexual intercourse. But obviously then when they want to have children, sexual intercourse becomes an issue and they need to deal with the problem. I mentioned that not many people talk about it, so there seems to be a lot of shame and guilt and so on associated with it. But again, like other sexual problems, treatment can be very, very effective. And for the majority of women who suffer from vaginismus, the treatment is relatively short in terms of how many sessions they would need to see a psychosexual counsellor or a doctor who's trained in the area. And maybe 3-4 months for up to 80% of women would be adequate treatment to sort the problem out. Now there is obviously a small minority of women in whom short-term therapy will not work, and they may have to engage in more long-term psychotherapy. But it's a very satisfying condition to treat, for the therapist or the doctor, and obviously for the woman and her partner, because it can transform a very fraught and frustrating situation in a matter of months into a situation where they can have intercourse as easily and as enjoyably as anybody else, and hopefully have the outcome they desire in terms of pregnancy. The causes of vaginismus can be, again, physical or psychological, or a mixture of both. It is important that women, again, are assessed medically before they embark on psychological or behavioural treatment, which behavioural treatment is the most common that counsellors use. But in a high proportion of cases, there is a physical cause for it, and one of the most common ones is a relatively intact hymen. Some women still have an intact hymen, even though they've gone through normal puberty and gone through life like other women. Some women are just born with a tougher hymen than other women, and it needs to be surgically dealt with. Infection in the vaginal area, inflammation in the vaginal area, skin conditions can also contribute in a physical sense. Some women after childbirth suffer damage to that area, either through tearing during childbirth, or the healing afterwards isn't complete, and that can be a cause as well. So there are lots of different physical causes. Psychologically, generally the cause is associated with, there tends to be a history in women where the cause isn't physical, of some sort of abuse in their background, whether it's sexual abuse, alcoholism in the family, physical violence within the family, over-sheltering, over-protection. That would broadly cover the main psychological causes.